Hello, welcome to Journey to Digital First. My name is Allison Breeding. I'm the CMO at Aptio, and I am joined here today by Jeri Koester from Marshfield Clinic Health Systems. Welcome, Jeri.
Thank you for having me.
Yes, we've got a lot to cover, so let's go ahead and get started. Jeri, can you start off by providing us just a high-level overview of your role and responsibilities within your organization?
Yeah, sounds wonderful. So I am the CIO of the Marshfield Clinic Health System, and for those that are not familiar with Marshfield Clinic, we are a 106-year-old organization in central Wisconsin, and we have 12 hospitals, including a children's hospital, and about 74 locations across central Wisconsin. And part of our story is much more about us really delivering and being innovative around rural healthcare. And so that's why TBM is such a critical component to our success as a health system. My responsibilities as the CIO is not only the technical components, but also the digital transformation, as well as our data and analytics, our enterprise project management office, and our process improvement team. And then I also have a new team, which is our consumer experience and strategic design team, which is critical for our digital transformation.
Great. So where is Marshfield Clinic on its digital transformation journey?
Well, it's no secret that healthcare seems to be a little bit farther behind than most industries around digital transformation.
Especially rural.
Yes,
right?
Exactly. And so we are, with the pandemic, accelerating our digital transformation journey. So when you close the physical locations of your facilities because of a pandemic, you really have to be creative about how you're going to service your customers or your patients. And so we implemented things like a mobile app. We had to quickly implement telehealth. We had telehealth for the past 10 years in our organization. But unfortunately, it took a pandemic for the adoption to really catch up with it. And so we quickly went from, minimal telehealth appointments to that was our only mechanism to be able to care for our patients. We've also started our cloud journey, and we've been implementing a lot of foundational systems within our organization as well. So we're definitely accelerating all of the digital capabilities at once.
What are some key initiatives you and your team plan to put in place and implement as your strategy matures?
Yeah, so one of the things about rural healthcare is that over 70% of our patient population is Medicare, Medicaid based. And so anything that we do from a technology perspective, we also think about it from the perspective of the patient. Would they pay for this? And because our reimbursement models haven't changed, and we cannot always just add cost to the system, so it has to be about a value conversation. So what we have done is we've taken the approach of looking at it from not only transformational, but incremental as well, and then looking at it internally and externally from a consumer perspective. And so we are always looking from a new business model perspective. We're thinking about improved operations, if we need a new delivery model, or if there's improved service levels as well. And so we are looking to automate work internally, but also engaging our patients into their healthcare as well, because we're really focused on a patient-centered care and a patient connectedness to our physicians.
That's great. So the pandemic forced about every company to become digital first, whether they were ready or not. How did it impact Marshfield Clinic? And did that change your strategy or your priorities at all?
It definitely impacted us, obviously, being in healthcare.
Right.
And so, we are a very patient-centered organization. So it made us have to step back and figure out ways to be much more operationally agile than we were previously as an organization. We had to send, 30 or a third of our staff home to work from home immediately, and then being able to deliver care from everyone's home. And then we also implemented telehealth to be able to reach those patients, whether it be via a video telehealth appointment or through a phone telehealth appointment as well. And then some of those other ideas around what hybrid care looks like, because our patients not only are driving long distances, now that the centers are closed or were closed, we needed to be able to deliver that care at the home. So thinking about how do we reach those patients, especially in central Wisconsin, we have been focusing as well on broadband access because there is a lack of broadband access to some of our patients. So how do you deliver hospital at home programs when they need to have some connectedness as well to our facilities?
Wow. So much to think about that you just, So as you reflect on the past few years and the changes they've brought, what are your 3 biggest takeaways?
And I'll start with the first 2. The first one is that as a healthcare goes through and comes through this pandemic, most healthcare organizations have a strong strategic agility to them. But with digital transformation, we also need to have an operational agility. We need to be able to get away from very large monolithic systems, and we need to be able to focus on much more agile ways to be able to reach our patients. Not everything can be one answer for every patient because healthcare is personal.
Yep.
And so if you want to be able to engage people in their health and wellness, you definitely need to be able to think about it from a patient-centered perspective. And then again, being able to add that agility makes us more nimble. The other thing that I would also think about is engaging in our patients. That strategic design team is really understanding the person as a whole and as they're going through their whole health journey.
So what challenges are you currently facing within your organization and as a CIO? I mean, there's a lot, right?
Yeah. As a CIO, healthcare in general is just facing so many challenges. There's not anything that you don't hear within healthcare right now that isn't posing a challenge. Thinking about it from a reimbursement model, being able to move to value-based care as a CIO's perspective requires data. And we're still working on structured data and being able to exchange that data appropriately. Also thinking about healthcare in general from a workforce shortage. We definitely need to think about ways to automate and being able to allow the care teams to do care team work and not have to do paperwork in that process too. So reallocating our resources to what is value added to the patients and automating the rest of it. And, thinking about it also from a rural healthcare perspective. I mentioned earlier about broadband access and being able to provide hybrid care. All of these are definitely things that are facing healthcare in general that we're all being challenged with. And as CIOs, we become very much part of that solution.
I didn't even think about broadband access. Like, what does it solve for that?
Well, we're being very, very creative. We are working with the communities. We're also working with our government within Wisconsin and trying to identify where there are gaps in broadband care and working with them to help provide that funding for that last mile to provide that service. We're also working with other things like Starlink and being able to be very creative on how we're actually providing that in those communities. So, and another example is our mobile mammography. We're also equipping it with broadband access so that people can come to our vans in order to be able to get that care in a parking lot as well.
Wow. How have you been able to shift the dialogue with the business as a result of TBM?
TBM has been critical to be able to shift that dialogue. And, as mentioned earlier, we definitely need to talk about value. And so TBM has allowed us to understand the services as an IT organization that we bring to the business, but it's also allowed us credibility to shift that conversation to a solution to the problems that we're trying to solve. And so we bring that value to the organization through our TBM practice.
So Jeri, let's switch gears a little bit and talk about a topic that I know is near and dear to both of our hearts, and that's women in leadership. What advice would you give to fellow women who are looking to advance in their IT career?
So the advice that I would give, the first thing is to build relationships. That is part of the core innate ability with women is to really understand people, and being able to build those relationships to help you be successful will be critical across all areas of your organization and outside your organization. The second thing I would give as advice is that, there's a great ability for a mentor and a sponsor in order to help create the visibility that women need in order to elevate within the organization and move into positions that have the ability to make change. And so finding that mentor or mentors, your personal board of directors, and that sponsorship is critical in order to move forward in the in any organization or in healthcare IT in general. And then the other thing that I like to remind women in healthcare and IT is to be authentic. Women bring that authenticity and the ability to add empathy to that equation. And by being authentic, we bring more power to the conversation. And if you think about it, especially in healthcare, 50% of the population is women. And so when you're thinking about our representation and being able to have those decisions being held, having women representation there is extremely important. And your authenticity and your empathy to that is what makes us very, very critical to the conversation.
I love it. I love it. Never underestimate the value of a network and be your most authentic self and lead with empathy. That's great.
And that was a great summary.
I love it. What do you think we should be doing to encourage more women to consider a career in tech or in tech leadership?
So I think the most powerful thing that we can do is just being visible. And it's hard to picture yourself in a position if the position is already predominantly male and that's all you see. And so just by having the visibility of women in these positions will help. So I think about when I first started as the CIO for the Marshfield Clinic Health System, I looked at our website promoting our IT organization, and the first thing that I saw was all the pictures on the website were all male. So we quickly changed that to make it inviting to girls to join and women to join. And then being visible in high schools and being visible in middle schools and in colleges and being present in organizations like this is extremely important to being able to picture yourself there and help elevating women to the conversation.
I love that. I love that. The future is bright for women in technology. I love it. So I'd love to just get some thought leadership topics out there for you. Can you share some of the biggest trends you're seeing and how your organization's rising to meet those changing trends?
Right. So, there is a lot of conversation around healthcare right now, and what is healthcare going to look like, as well as, how do the patients engage in their healthcare? If you think about it, traditional medicine has always been about the diagnosis, the treatments, and the preventive nature of any chronic conditions. But as the pandemic has taught us, there's so much more to a person's health journey that is outside of the four walls within an organization. So I see in healthcare that we're moving much more into the personalization of healthcare, as well as the patient coming in from a consumer perspective and really deciding how and what they want to do from their healthcare perspective. I see us needing data and data science and AI to be able to deliver that at the pace that we need to from the information that we'll have available to us. And I also see us having to really step up to the challenge around our workforce shortage and really becoming optimized within our organization and with the staffing that we do have, because as all industries are facing, there's not enough people to do the work, and that's true in healthcare as well.
What key things should all CIOs be looking to do in the next 1 to 2 years?
First, obviously, is to understand your IT, understand the services that you're offering, as well as understanding the value that you are bringing to the organization. Secondly, starting those relationships and those conversations in order to make sure that aligns to what the business objective, the mission and the vision and the values of your organization are, in order to ensure that it's aligned to the highest value to the organization. And I think that is going to be absolutely critical in all businesses as we have going forward, regardless of the industry that you're in.
Agree. Thank you so much, Jeri. That was very insightful. I really enjoyed the conversation today.
And thank you so much for having me here today.